hospital. When you read a book written by Albert Cook, The Tones of Black and White, when they're talking of the reinvention of medicine in Uganda, how medicine has been growing, it well explains how physiotherapy came in. So the first physiotherapists in Uganda were picking girls from Gaza High School, taking them to London for training, then bring them back as physiotherapists. So in Uganda, we go to see physiotherapists who are very much needed in pediatrics because of the cerebral palsy, and we had so many physiotherapists taking interest in cerebral palsy, club foot, their children born with their foot in.
Yes, like in, out, let's say, something like that.
Yes. Then the physiotherapists will help they'll help the children. And as we keep growing, we might get injuries. When you get injuries, the physiotherapist is going to help you with your muscles, your nerves, your bones. Now, someone might wonder, why don't I just get a pill, for example, if I have a muscle pain?
Why don't I just get a very strong painkiller? I take it so that the pain can wear out.
Yes.
We are Africans. We take long to go to hospital. By the time we realize that we want to really go to hospital, when the pain, I think, is intense, but when the pain is still there, I'd rather go to a pharmacy, a quick one, and I get like, a Panadol, a strong painkiller, and then I swallow, and then this pain will go away. But then after like a couple of months, then this pain will come back.
Now, you're right on the mark, because physiotherapy, we are not targeting your pain, but it's to know why do we have the pain. Pain could be caused by a nerve. Pain could be caused by a weak muscle. Pain could be caused by a stiff joint. As a physiotherapist, I go in to help those things. And we have different modalities we use in physiotherapy as we treat. Most of the times, I hope one time that we can get our local bayunzi to sit with them so that we can get some of our local knowledge, I think. Well,
when you say about that, now it rings a bell in my head that, let's say if I dislocated my ankle and I go to this local bayunzi and then they try and put back my, is that physiotherapy? Abayunzi chebakode, is that physiotherapy? Or it's more of local? I'm a Pan-Africanist in nature, and we want to stop colonization of some of this knowledge, even if I'm speaking a colonial man's language. But I do believe that we had room for physical therapy as a culture. Yes.
We had the room for these practices, they were yunzi. But we may not have grown the science of the Buyunzi, but we still have this knowledge.
The little knowledge.
We have the knowledge within us. The principles, we knew them, that but they were not developed after a period of time for someone to observe. Because
why I've asked you that? Because I personally don't believe in them. Why? Because I had a brother who got an accident, and he was admitted in hospital. Then after some time, he said, my wife has arranged that I go to this local Bayunzi. But they damaged the leg more.
Yep.
And instead of putting it right, they damaged it to an extent that he had to go back through theater, and later on he had to go through physiotherapy. So Abayunzi and the physios, are you people the same?
One, like I said, it's the philosophy in which we work. The physiotherapist is going to go to school to study the anatomy and physiology, and we study intensively to understand, I don't know, the amount of time I spent studying muscles and bones from head to toe, where they insert, where they originate, and which nerve supplies them, which blood vessel supplies them. Unfortunately, our local healers may not be able to get this kind of thing because,
excuse me.
Our local healers may not be able to get these kinds of services done because lack of the training. To them, they start practicing because they dreamt that he's a very good, or he was born knowing a talent and skill. Meanwhile, in physiotherapy, we study these things, so it's not inspirational. And it has been documented with a lot of our practices. It has been it has been noted with a lot of practices.
Get your favorite health tips right here on U24. Maintain your kidney by drinking 8 to 10 glasses of water each day. This can be in form of soup, tea, water, cooked grains, and boiled vegetables.
Hello, my name is Erica Murunji and welcome to Be Inspired by Erica. So today I want to talk about personal hygiene. Personal hygiene is not just a habit, it is a way of life. By maintaining personal hygiene, you will reduce stress, improve on your focus, show respect for yourself and others around you, to the people around you. Take care of your space and your life. Keep your room tidy, wash your hands, cut your fingernails, comb your hair, brush your teeth, and many others. Take care of your space and your life. Brush your teeth, make your bed, bathe, cut your fingernails, comb your hair, and many others. Make cleanliness a habit. Personal hygiene should be a priority. Cleanliness is next to godliness. Stay blessed. Much love. Thanks for watching.
Hi, my name is Doreen Tuhirire, coming to you from Be Money Wiser, and we're going to be bringing to you the hashtag 100 Ways to Be Money Wiser by Mrs. T. Tilda Nabandra. We're going to be running this hashtag 100 Ways to Be Money Wiser on U24 television. Don't miss out.
U24. Don't miss on U24.
Entrepreneurs Hub, giving you a deep and unique insight into agribusiness, services, ICT and innovation, industrialization and so much more. Entrepreneurs Hub, growing your small, medium and large business entity. With yours truly, Sandra Kahunde.
We're still talking about the nerves and the muscles. and I was talking about the bayunzi. So you are still explaining to us about that.
The difference, the bayunzi. The bayunzi, the science of our medicine here in Africa has failed to change from spirituality to being typically scientific. So the bayunzi, indeed, they've been very helpful to our community because there are places in Uganda who have less than 1,000 physiotherapists on a population of 45 million people. We have less than 1,000 orthopedic surgeons. So the room for the bayunzi for a third world country like this is there. However, they have limitations on the things they're able to do or not to do. There are bones that are broken, and the muyunzi will be very competent to fix. However, there are some bones that have been very challenging for the bayunzi to manage. And in most cases, we're working as a society to ensure that we even get them a way of teaching them some of these things, because you find we're told when someone's hurting, gamba,
Onyigira ddala. And doesn't that cause more pain?
Yes. Now, in the process of kunyigira ddala, because when a bone is broken, for example, we have a process of the bone coming together and reuniting. So we have something called I'm forgetting. We get calcification. We get the joint starts creating membranes around it. And when it does, it creates the cement around the two bones to heal. There becomes a lump. But what we've noticed, most of our bone setters, they'll go and instead try to break that over and over and over. So when callus forms, we call it callus. When the bone breaks, callus forms. Callus is like cement start coming back in. Your bone creates it. Your body creates it to get the bone together.
Slowly by slowly.
Yes. Now, when we go to bone setters, some of them, they keep breaking it over and over, and some are not properly guided. So you have sometimes where someone has gotten an injury and he has a wound, and there's a bone that is coming out, or what you call compound fractures that are very complicated, I would encourage you to go to a hospital to be managed other than a bone setter. They've been helpful with some people, but there's a time when there's no room for that. So when we come to physiotherapy, you've talked of Bayunzi, who they're confused with the physiotherapist. Then someone goes like, what's the difference between a physiotherapist and a masseuse? Because if you look at the way the physiotherapist does work, it looks like they look like what everyone else is doing. Now, in physiotherapy, we study intensively what you call soft tissue manipulations and orthopedic manual techniques. These are principles of treatment where we go to work with the muscles, and when we're working with the muscles, it may look like massage, or the way massage is done.
So am I supposed to go to the masseuse?
I'm coming to that.
Because we see very many people, yeah, I'm feeling pain here, then you go to the masseuse. Then you have a back problem, you go to the masseuse. Then your leg hurts a bit, you go to... Because, of course, there are different massages that they do have.
The massage is good, done by the masseuse. But when you have a pain...
A problem.
Escalating,
should we say that?
When you have pain, or you have something that has been coming in over and over and over, it's very essential that we get to see someone who has been trained to do this. Physiotherapists are highly trained. They are trained in the medical school with intensive grilling. The Bachelor's of Physiotherapy is a 4-year program. A diploma is 3-year program. Now, most of our masseurs is a 2-3 weeks program someone does. So while it looks, and you may think that we are working with massage, it's not the same thing. Then we get to see people who look like, I'm giving you things that look like physiotherapy. Then we have what we call chiropractors. Chiropractors are also amazing in helping people, cracking the bones and all that. However, most of their principles and things they believe in, we call them pseudoscience, because some of them are non-scientifically proven processes to be repeated over and over and over to give results. Then we have chiropractors, we have masseurs, and then we have athletic trainers. So when you go to the gym, you have an athletic trainer. The athletic trainer is going to help you with exercises and all that. I use exercises as a major thing in treating patients. However, our exercises are well graded in the way we give them, on knowing the strength of you, the individual, your status. Are your muscles strong enough for you to do these exercises? And how do we grade them? For example, you could have back pain. And when you have back pain, you'll be told, go do exercises. However, you could do some exercises that make your pain increase more.
Yes.
And then
like bend or sit, then they tell us sit, and then you do sit-ups, then the back pain will be better. Then they tell you stretch. There's a way people tell us to stretch. So which is which?
Yes, but our exercises still outtreat the back, but with a different kind of exercises. We are masters of exercises. We are masters of movement.
Yeah, of pain, of every nerve.
Every nerve. Now, we have an instance where you're in hospital, for example, in ICU, and you're not able to move.
To move, yes.
We shall come in as physiotherapists in the ICU to ensure
that the body is...
We are still moving the joints. We mobilize all the joints. We are going to go to your chest and make sure that we help you to excrete most of the mucus if it's needed through the chest. Then we help you get into recovery. Physiotherapy gets you into recovery. If you did an orthopedic surgery, for example, you broke your hand and you did a surgery, without physiotherapy,
you can't get better.
You're lying to yourself. Now, there's a soft spot that we physiotherapists enjoy. I'm sorry to say that I enjoy. One of them is neurology. We have neurological diseases. Those are the diseases that affect the brain and the nerves.
Oh, dear.
And those diseases that involve stroke, for example, that is increasing at a very high rate in our country. Stroke.
Whereby you were okay, and all of a sudden you sleep and you can't move anymore, and the left side is all gone.
The left side is all gone.
Yes.
When you're done with that and you're out of hospital, we need to start doing exercises immediately. In most cases, when we tell our patients that you need to see a physiotherapist, for them they get to think, nabalabye mu ddwaliro nabalina engeri gye batambuzaamu bwe batyo mpola mpola, and they are so much convinced that it's very simple. But when we come in as physiotherapists, we take back this patient into teaching them coordination, because, for example, most of the neuro diseases, they are not diseases of the muscles, they are diseases of the brain.
They affect the brain.
Yes, so we go to that brain and start teaching the brain and tricking the brain into doing particular kinds of exercises and getting you back in shape as a person the way you were before. And this we do through exercises. For example, in a stroke patient, I love neurology and
the stroke parents, because some of them, when they get stroke, the hand is like like this. It doesn't come off, and then there's a way the leg looks like.
I think one of the things we're going to do, we're going to expound on stroke.
Yes.
One day we're going to look at stroke.
Yes.
We'll film the whole stages of stroke.
Yes. If you could only give us a little bit hint about the stroke, because I have a friend of mine, and he got a stroke, but he's walking, but you know his arm and leg are still there, but he's trying to walk. But basically, he uses one hand. There's a person that uses one hand.
When we come to stroke or neurological conditions, technology has gone way
beyond.
Yes. And I would fortunately say this, that Uganda, we are like 30 years behind.
Wow.
In technology.
Why would you say that, Dr. Adrienne?
Because in one of my trainings I did out of the country, I got to notice that my patients would recover quicker than those who would recover in Uganda. I'll give a scenario of what happens with the stroke patient. When someone gets a stroke, I'll give a typical example of my village in Zimbabwe. Someone gets a stroke.
They are bewitched.
Twamusanze muzeeyi ibwo twamusanze ali awo aluma olulimi etulutegeera ayogera ebintu baleka balina bye bamukoze.
Bagamba abo bamuloze.
Then we first kunyokezaako a little bit. Akati now by the time we're going to find Abudu okujja n'akapichike
amutwale mu
ddwaliro naye kati wamutwalira from, I'm giving a typical example of my village. Agenda mujja wamutwale wa Muhumuza, wa mwami Dr. Muhumuza is a very good physician, a very good hospital in Zimbabwe. Wa mwami Muhumuza bakutuleko naku lumu bbiri bagamba akati omulwadde wena mutwala wa
Mulago.
Wena mutwala Mulago. But from the time you got a stroke, it becomes a medical emergency. Every second counts.
Passes. Every second, every minute, you're going down.
You're going down.
Wow.
Counts. And now your brain is getting more damaged because you've not done any intervention. So by the time you get to Chitovu Hospital,
it's too late.
It may not be too late. Now they tell you, oh, we are going to do a CT scan.
Wow.
A CT scan, and then like a CT scan is how much? Is 250. Then someone goes like, "Katsoko kubire kugundi,
atunde embuzi
ata akatenti akatunzo kubanga oli musizo niwagamba nti ate neno sizo je tuli muti tuli mu quarantine tebatunda ante." Then you first call 1, 2, 3 people. So a typical Ugandan, leave alone the people in Kampala, would be attended to after like a day or two from the time they got the stroke onset. Now we are done, we get through the stroke. Let's say you're lucky enough, you managed to go to Masaka Regional Referral, and then you're managed very well. At that moment, you need to start rehabilitation.
Immediately.
Then we are going to look at your rehabilitation for stroke into what we call multidisciplinary approach of managing you. One, depending on what we've noticed, sometimes you could get a stroke and your speech is affected.
Yes, I was actually about to say, some people that get stroke, they take long to talk or to speak. Why?
Then, because we say the stroke will damage the brain.
The brain, one side of the brain?
Yes, one side of the brain. And when the brain is being damaged, that part that is like a hard disk. Well, you remember those CDs we used to use at that time?
Oh, yeah.
And then the CD would scratch, and then every time we put it in, the new generation may not understand the problems we had with DVDs.
Man, DVDs, talk about
Yes, so the way the DVD would scratch, so the same, your brain has somewhere this information, it is scratched. So someone can talk. By that time, we need to engage an occupational, we need to engage a speech therapist. The speech therapist will come in to teach you and coordinate and help your brain into knowing where it kept the words.
So literally, you're starting to speak like a baby.
You're starting to speak like a baby, but now from a very complicated point of view, because you're aware that I'm able to do this, but I'm not able to do it now.
And then it gives you this, and then you break down the more.
Now you've brought what I was coming to.
Yes.
80% of stroke patients suffer with depression. So if you're managing a stroke patient, it will be very essential also that we get to know, do I need to engage a psychologist or a psychologist or a psychiatrist at this particular point of time? Then as physio goes on, we might come to a level where, like, now this hand, we've gained some function, I need what we call an occupational therapist. The occupational therapist comes in to start helping
you to hold.
Occupational therapy. Occupation, he will teach you activities of daily living, and then will help us into compensating for some of the things you may not really.
You're basically becoming a baby again.
Yes.
You're learning how to walk,
You're
learning how to talk, learning how to hold. Wow.
As a physiotherapist, see, when I'm working with you, I'll go back to teach you from learning to roll in bed, learning to sit, learning to stand, and learning to walk. And those come in a systematic way. On the therapists have been trained on how to get someone through those levels. Now, in our system, we said, why don't Ugandans heal quicker? It's a bit tedious.
You see, the problem, or why you will say we might not be healing quicker, is sometimes we look at the money, the amount of money. The physiotherapist, you go to a hospital. Recently, my mom has been going through physiotherapy, and by the way, it has helped her. And you know, it started as a joke. She got, you know, a simple back pain. And it had actually been there for some time. And the mom is complaining, my back, until we really went to a doctor and started physiotherapy. And she somehow became better, and she can bend now, she can do her usual work, but the money.
The money. You see, rehabilitation, as a country, we have two big challenges. No, not as the country, as a continent. Because the problem I'm going to talk about is not only in Uganda, but we see it in most low middle income countries. We had a burden of communicable diseases. We had a burden of malaria. We had a burden of such infections.
You know, those funny diseases.
Now, as we're still struggling with those diseases, then we're getting a burden of non-communicable diseases.
Yes.
So for example, Kenya, our brothers in Kenya have been pushing, and they have like around 6,000 physiotherapists, and our numbers are still very low. Our bachelor's program in Uganda has spent more than 10 years since it was started. So the numbers are very low. However, there's been little invested in rehabilitation across board, either from the private sector to the government sector. So it's capital intensive. Even training a physiotherapist is very costly. However, I think the Ministry of Health of Uganda has now taken down to have physiotherapists up to Health Center 4. So when you're out there, you tell your MOP to ensure that you get your physiotherapist in a Health Center 4.
True.
Because in the new scheme of service, the government has provided, I thank my members of UAP who have pushed Uganda Association of Physiotherapy, who have persistently pushed to have these numbers and give a case of it. And we thank the government that listened to us and goes like, you know what, we're going to give you those slots. So now we have a physiotherapy starting at Health Center 4, to a district level, to national referral. However, free healthcare is something.
Still a challenge?
It's still a challenge everywhere. I think as a country, our policy may need to come in to help us deal with the free healthcare and the national health insurance, so that people can really afford. Still, in one of the researches that was done by Mbara University, we got to find that most of the physiotherapists were sitting within Kampala or the central region.
They're not in up-country hospitals, basically, or they are fewer there.
There are fewer there, but the beautiful thing now, physiotherapy is growing. Now we are even setting up a private physiotherapy facility in Chihihi, which you would not have thought that Chihihi could have a physiotherapy, a gym, and so if the economies, it's just economies of scale that we need to work on as a nation, and the cost of therapy has been very high worldwide. Even in the UK, it is still a very big a big challenge.
Doctor, let's talk about these things that you use in physiotherapy. Certain times we go for those physios, and there's a fridge there. It's a very cold. It's like ice. It's not like ice. Something very cold. Then they put it on you. Then they cover you. Then they again put it on.
Hey, yes. You see, we said we do use physical means in treating. So we use electricity.
Yes, then something that will vibrate on your body. Wow.
So that's a TENS unit, or electricity TENS on your neuromuscular stimulation, nervous, any NMS or muscular electrical stimulation, where we are going now to stimulate using electricity, and we start stimulating those particular muscles that are paining. We can use electricity to stimulate the muscle that is paining, to reduce the pain. We use the electricity to activate that particular nerve that is not working, and we use electricity. Those are the two instances where we're using electricity for pain and reactivating a nerve, so that the electricity keeps going. Our bodies work with electricity. The next thing we use is heat. Heat, where we use heat to treat, because when we put heat on your body, and we know it, heat has been helping us to heal pain even before the Muzungu came. When you go to your mother in the village, my Machiga friend.
When you're called, mommy brings a kasigiri.
A kasigiri. For you, your mom even has a kasigiri. I'm talking of my people down there where we get the stone. Tuchiteka mucho tejinya, tuliteka mucho. Tukiya kumecheni, tulikuteka ko. You remember when you have a wound in the village, they get kazimu and you put it in fire?
Yes.
So the use of fire, of heat to treat, is a traditional thing that we have improved and now know we can do it with infrared lamps. We can do it with, we have both heat that is visible and non-visible heat, where someone can use a lamp, that lamp people see, which is lighting everyone. Or we can get a hot compression and put it. So what we're trying to get is changing temperature to facilitate healing in that particular place. But not all pains will be helped with heat.
So what is another method?
Another method is ice, where we use cryotherapy. Cryotherapy is we use ice to treat pain. Ice helps us to first numb the pain, and for a long period of time, then it helps us with circulation.
Can I get my ice from the fridge and put it on myself? Or it is different? The ice that you use is different from the one that I have in my fridge?
If I was a money-making person, I would have told you, ice good because we get water from Mississippi River using your left hand. No, it's not that kind of ice. We just use any kind of ice. Ice, even you can use it yourself. And we even teach our patients to treat themselves with those things. And then we have heat, then we talked of the massage. Then those we call them passive.
But those ones that real massage, and then instead of healing the pain, cause the pain.
It's
I don't know, do they overdo it?
If you're going to meet a physiotherapist, I wouldn't think they're going to cause you pain, because it's very aggressive teaching. However, if you're going to find someone on the street because they look nice and they're going to give you a massage and they don't know much of how your human body is made, then it will become a bit harder for you.
Well, you are still watching Q24, Sheila Kahundi and of course Dr. Adrian. And today we're talking about physiotherapy, and it's broad. We want to take a very short break. When we come back, I want Dr. Adrian to explain to us more about these massages. I go to a hospital and I want to heal pain. But instead of healing, I come out when I'm even limping the more. And of course, you tell us the different nerves and the muscles, and of course, a little bit of the bones when we come back from the short break. So let's take a short break, and when we come back, we'll be still with Dr. Adrian. And of course, we're talking about, he taught me something new, physio and then therapy. Then when you combine these words together, that's when you get the word physiotherapy. Let's go in for a very short.
Get your favorite health tips right here on U24. Maintain your kidney by drinking 8 to 10 glasses of water each day. This can be in form of soup, tea, water, cooked grains, and boiled vegetables.
My name is Erica Murunchi and welcome to Be Inspired by Erica. So today I want to talk about personal hygiene. Personal hygiene is not just a habit, it is a way of life. By maintaining personal hygiene, you will reduce stress, improve on your focus, show respect for yourself and others around you, to the people around you. Take care of your space and your life. Keep your room tidy, wash your hands, cut your fingernails, comb your hair, brush your teeth, and many others. Take care of your space and your life. Brush your teeth, make your bed, bathe, cut your fingernails, comb your hair, and many others. Make cleanliness a habit. Personal hygiene should be a priority. Cleanliness is next to godliness. Stay blessed. Much love. Thanks for watching.
Hi, my name is Doreen Tuhirire, coming to you from Be Money Wiser, and we're going to be bringing to you the hashtag 100 Ways to Be Money Wiser by Mrs. T. Tilda Nabandra. We're going to be running this hashtag 100 Ways to Be Money Wiser on U24 television. Don't miss out.
U24. Don't miss on U24.
Entrepreneurs Hub, giving you a deep and unique insight into agribusiness, services, ICT and innovation, industrialization and so much more. Entrepreneurs Hub, growing your small, medium and large business entity. With yours truly, Sandra Kahunde.
Welcome back from that short break. Still with Dr. Adrian. He is a friend, he is a brother. And finally we get to meet again and we're talking about physio. There are two words. Now today I've learned something new. Learning never ends. Physio and therapy. When they combine these words together, then they come out to be called physiotherapy. Now the doctor was explaining to us different techniques of doing physiotherapy. Some can use massage, some can use, a stone, but this is his thing. Have you gone to a professional, or you just see someone beautiful and you feel like this person can do massage on you, which is not the case. Well, today the doctor did not move with his dummies that he uses to explain to us, but we're going to get time and really get doctor back into the studio, and he comes with everything to explain to us. Doctor, before we took a short break, we're talking about the nerves, the bones and the muscles. We have different bones and muscles. Sometimes when you go to a hospital, someone just, as I was explaining, you come back limping. You want, when you are like, ow, ow, you come back limping. Do these people know the muscles and the nerves that they are supposed to touch?
Sometimes physical therapy can be uncomfortable because exercising something that you've not done before. However, wouldn't expect you to have pain after you've done therapy, because what took you in is pain. But if your therapist is explaining to you that, oh, I expect you to have a bit of discomfort, which will go after a period of time, then it's understandable. Your therapy, we are not physical terrorists. We are physical therapists, but not physical terrorists. Now, you talked about some of the common pains. I'll talk about is sciatica. We've had people complaining of pains that come down into their legs, and the back, and that pain comes all the way. Someone feels pain in their lower leg all down to the leg.
Yes, yes.
And when they sit, that pain comes in. And that's one of the common pains we know is called sciatica. Sciatica is caused by compression of the nerve, and the pain gets to be
basically, so the pain comes from the lower back?
Yes.
And then it goes up to the...
You feel the pain in the leg. Sometimes it increases with walking. So every time you have pain that is increased with movement, or you feel the needles and pins, the burning sensation.
Yes, sometimes you feel some boots,
yep, those are caused, that is caused by a nerve compression. And those nerve compressions could happen in the back, the lower back. In the lower back, we have bones and ligaments where the nerves go through. But somehow, every now and then in life, they get to be compressed and they will give us that pain. Or sometimes you could have the pain coming through your gluteal, your bum area.
Yes.
And you have too much pain.
Like my boy here, Tyson, he got an accident and he passed through the window of the bus. But then you saw it here, said like, now the pain keeps on coming from here like this, and then and it doesn't come like every day. Today the pain is on, and then tomorrow the pain weighs out, and then after like a particular time, then the pain comes back.
If you have pain like that and you got trauma, I would highly encourage you to go to hospital so that we do proper imaging and diagnostics, because sometimes we do get these pains and there could be a broken bone that needs to be fixed.
Yes.
So that is very essential. However, I'm talking of pain that has started without trauma, without feeling sick, and if you get that kind of pain, radiating pain, you have back pain, but you're losing weight,
then you have a problem. You need to seek medical attention.
You're having fevers, you've lost appetite. Please go to hospital ASAP for proper evaluation. There could be something else. But I'm now talking about the pain that has come in. You do not have fevers, you do not have headaches, you do not have any of those complicated things, and you get that kind of pain. That's when we come in as physiotherapists to manage. So most of our patients would like to come in 1, 2, 3 sessions and the pain goes and they disappear.
You know, we come for 2 days and then the next time like, mponye kati, I'll go back the next day.
When I'm managing my patients, we'll typically have a month's program for back pains, and especially if someone has had pain which we call chronic. I would have you for a long
period of time.
We get into sessions where we're only managing pain for the first 3 or 4 sessions, just to deal with pain. The next sessions we're going to start into is conditioning your muscles and exercising and helping you. If you need, we'll get to see how you work. Is your ergonomics right? Are you setting up your offices the right way? And then we can take it from there. So we're very critical on 2 to 3 things. 1, we have to ensure that you do not have any underlying condition. Even the things we've talked of, the tents, we've seen them now in Kampala, people selling those equipments in pharmacies, or some people bring them.
These equipment, doctor, thank you for mentioning them, where you put up and your hands have not been doing like this, and then it's like a hand,
that's a glove.
And then
we use it in stroke rehabilitation.
Now these days you see people selling it everywhere, and then people, but you haven't gone to a doctor to advise you whether you should put it on or not.
One of the things Ugandans might find very interesting, or Africans, is how complicated some things are. They look very simple on the top. But they're
very complicated.
They're very complicated on the outcome. For example, when I talk of pain and I'm like, no, we're going to first deal with your pain, recondition you, then do what we call maintenance. How do you avoid this? And with this kind of program, when we do, we've got very low recurrences of back pain. When we even go to stroke, for example, the way we approach our stroke patients is kind of completely different. We would push for more consistency than intensity. And we get to do most of 5 therapy sessions with our patients for 1 hour's therapy, then plus speech therapy, occupational therapy, and psychotherapy. And every time we've had those multidisciplinary approach, and then we tend to follow up with you. The other challenge could be that you get to be sent to see a physiotherapist by your orthopedic surgeon, and once in a while your physiotherapist may not get a chance to speak to your orthopedic surgeon to explain to them what they're doing. So there is that lack of continuity of care between the professionals. However, when you get an opportunity to meet your orthopedic surgeon and your physiotherapist in one place, and they can sit down to have a conference about you, we get amazing results. Every time we've worked with as physiotherapists in a multidisciplinary program, you get amazing results. Now we go back to the cost thing you talked about.
Yes, yes.
I think it's a catch. Everywhere you go, people tell you the cost of therapy is very high.
Yes.
And I think
some
now...
other people, I think a session is 70,000 every per visit.
Yes. Mulago National Referral is, I think, 20,000.
But the line...
The line, you can't have your cake and eat it.
True.
Yes. So I would say most of the regional referrals, all of them have physiotherapists in them. We have Mulago, there's a physiotherapist. We have...
It's abroad, basically in all the hospitals.
It has been an endeavor. So if you can't have a beer, budget with a champagne test.
I know. Yeah, the beer budget is different from the champagne test.
Yes. but then if you feel like you want to have a champagne test and you have a champagne budget, then you can look for Adrian, and then we...
Now, doctor, as we do wind up, I can see my producers coming in studio to tell me about the time. As we wind up, what could be your advice to the people out there? Because we're going to have another session about next week, so that way we can come and you will explain to us. Now, as we wind up today, what could be your advice to the people? And just in case these people want to come to your hospital for physio and therapy, where do they get you from?
My advice to the people, you need to keep active as much as possible. Exercise, walk, banakampala, tutambule, umukulembeze mumulaba, adduke,
that man is very fast.
Very fast, is very fit. And that's the beauty of exercise. Exercise is not to make you look fit, but it's to help you reach 70 years and you're still challenging people in moving. Where do you find us? We are located, I practice in two places, in Nalia, the rehab clinic, where we're located, and then UNGA at MUFK. And these are places that are set up for different things. For example, Nalia, we're targeting Nalia for neurological conditions, and in MFK in UNGA we do more orthopedics and pediatrics, and that's where we do I work with other partners, orthopedic surgeons, in helping our patients.
All right. So do you mind giving them your number just in case someone might not, because you've mentioned about 3 places, so if I come here and you're not there and I go there and you're not there, what if I call you? Can you be of help?
Yes, you can call us, but you can call us on 0752 045 865, or you can look at our educational content on TikTok. We have a lot of education content, TikTok and Facebook and YouTube. And I think next week we shall be doing a demonstration on on broken bones and back pain. And
I hope, doctor, as we do leave my boy Tyson, my brother, is worked on is taken. This man went through a window. I don't know whether he must have been sleeping. Then he woke up. It's like there's an accident. Then he passed through the window.
We thank God for that. Tyson should come and have a look.
True. But thank you so much, Dr. Adrian, for coming in. I hope next Saturday when we have you again in studio, you'll be demonstrating to us the different bones and, of course, how can this bone be healed. Is there any faster thing? And also, my emphasis will be on the Bayunzi. We haven't finished that.
Thank you very much.
All right. Thank you so much for being part of this beautiful show all the way from the hour of 9. It's about exactly, 5 minutes past 10. I'm so sorry, my producers, for going through a bit of time. But thank you so much for going through. And also, do not forget that the campaigns are still going on in your local areas. So if you know there's a presidential candidate that is coming, please go through. And also, the future is in your hands and also on your ballot paper. Who will you vote? 2025-2026 polling is on, and of course we are going to be going to the polling stations to vote for our president. But the Excellency of Uganda, His Excellency the President of Uganda, he's still in the north traversing and of course talking to the people, and they're also telling him his problem and he's finding a solution for that. Thank you so much for being part of this. You can follow this conversation on our YouTube channel, which is at U24 Television. X is at U24 Television. Follow us on Facebook, Twitter as well, which I've just read, which is former X, and which is X apparently, and also on TikTok. Thank you so much. Have a blessed day. Do not forget to go to church. Tomorrow is a Sunday. Have a blessed day. We'll do this again next week on Saturday.
Get your favorite health tips right here on U24. Maintain your kidney by drinking 8 to 10 glasses of water each day. This can be in form of soup, tea, water, cooked grains, and boiled vegetables.